अटेंडेंट को ले लो.
So this is for the oral cancer cover. This is international recognition.
इसको इधर ला लेते ना बच्चों पीछे एक पीछे ले आओ. पीछे बैठो.
Chancellor Sahib, I understand that we have very busy schedule today. So yesterday I met him in the evening and I requested him if he could spare 5 minutes for these enthusiastic children and this cause, cancer care cause, for the care gap. And he was very kind enough to accept that. Thank you very much for being here. I know you have a tight schedule and you may have also to be on the side. Not having much time now, I request the Honorable Vice Chancellor to speak a few words. Thank you very much. Thank you. Thank you very much for the answer. I must congratulate the school of the Unani for jointly organized this cancer awareness week and from because we all know that the International Cancer Day is the 4th February and 9th is for awareness program. This time Jamia hamdard hostels are also organized some cancer awareness program and they have shown us some kits and all. So the cancer is a very deadly disease, and you all know that this is going to be a very second future because of many reasons. Maybe one of the reasons is also radiation. So always we are in the Wi-Fi zone. So radiation is the major concern nowadays. So we recommend them to take vitamin C when you are always in Wi-Fi zone. So take more vitamin C so that your radiation will be absorbed. So I must congratulate to Dr. Sohail Fatima and the organizing chairperson and secretary, and of course under the leadership of the Dean, Honorable Dean Dr. Asif Ali Khan, and all the faculty members for organizing such a big rally. Actually, I had some urgent, I had to go out of Delhi, so I thought I have to present at least 5 to 10 minutes with you. So again, I congratulate the whole Unani and physiotherapy and OT team for organizing this cancer awareness week and walk also. Thank you again for not taking.
And very pleasant morning to everyone present around here. I, Urva Zaidi, student of BMS First Prof, School of Unani Medical Education and Research, Jamia hamdard, would like to express my heartfelt gratitude to Honorable Vice Chancellor Janab Professor Mbbs Sahab for gracing this occasion with his presence, and Dean Sumer, Professor Asif Ali Khan Sahab for being constant support for organizing such events. And I would also like to thank organizing chairperson, head of Gynae and Obs Department, Sumer, Professor Suhail Fatima ma'am for organizing such impactful event, thus spreading awareness about screening, prevention and management of deadly disease like cancer. A special thanks goes to co-organizers, namely Dr. Shahla Nazir, Dr. Ruhi Azam, Dr. Mas, Dr. Abdul Nasir, Dr. Sohrab Ahmad Khan, Dr. Ruchi Nagar, and coordinators Dr. Sahid Zaidi, Dr. Nazia, Dr. Nahid, and Dr. Saman Anis, Dr. Hamad, Dr. Rashida, Dr. Arafat. They have worked tirelessly. To bring this awareness walk to fruition. Cancer is a global health concern and affecting millions of people worldwide. According to WHO, cancer is the second leading cause of morbidity and mortality globally. Recognized globally on 4th of February, World Cancer Day. Global Uniting Initiative led by Union for International Cancer Control. And the WHO theme for the year 2022-24 close the care gap. Everyone deserves access to cancer care. Underscores the urgency to address the disparities in cancer care. Everyone, irrespective of the background and class and circumstances, deserve access to timely diagnosis, treatment and support. So everywhere in the world, various activities are carried out like public speaking, awareness walk, health camps to spread awareness about cancer. So we at Sumer have organized 3 weeks program along with this walk to spread awareness about cancer, focusing on cervical cancer, breast cancer and oral cancer in particular, and all other cancer in general, rest of the cancer. 1 in 25 women has chance of getting breast cancer, and cervical cancer is second most common cancer in women in India, and a woman dies 1 in every 2 minutes because of cervical cancer. So after this walk, we'll be receiving along with refreshment vitamin C. This is basically antioxidant, and so we should start taking vitamin A, E, because they are all antioxidants. So thank you everyone for joining this with us. And so each step today we take is not just a stride on this campus. It's just a step towards a world where the impact of cancer is significantly diminished. Thank you everyone. We just walk with purpose and determination. Thank you so much.
Hello everyone, thank you for having me here. I am Mariam Mashkoor of BMS First Crop. Our school has organized an awareness campaign on cancer. Why is a मरीज too हुआ यही, and when I am ill, it is Allah who cures me. With these words, I would first like to thank you all for joining us in showing solidarity and raising awareness on breast cancer. It is a type of cancer that forms in the cells of the breast. It is most common in women, but it can also affect men. Doctor and rated check. Mammograms are another important tool in early detection of breast cancer. They are X-ray images of the breast that can detect abnormalities or changes in breast tissue that may not be seen in ultrasound. In the breast or underarm area, changes in the skin texture of the breast, nipple discharge, etc. It is recommended for a woman.
Perfect. खड़े में आ रहे हो पीछे आ जाओ, पीछे बनाओ ना, इधर से होगा। उठाओ भाई।
यहाँ से मेन रोड पे चलिए यहाँ ज़्यादा इंट्रैक्शन हो रहा है स्ट्रेट लिए वो सारे सबको दिखेगा आपका वो ज़्यादा लोगों को यहाँ पे मिलेगा नहीं। होटल पे जाके ये फोन कर गया स्कूल वाला करेगा कौन सा है ना हमारे से थोड़ी रूटीन सामान झुक जरूरत नहीं है
बोले यार रुक क्यों गए इस वजह से
And very pleasant morning to everyone present around here. I, Unani, a student of BMS first from the School of Unani Medical Education and Research, Jamia Hamdard, would like to express my heartfelt gratitude to all the teachers who took time from their busy schedule and grace this occasion with their presence. And I also like to thank our organizing chairperson, Professor for organizing such impactful events.
Transmitted through sexual contact. One woman dies from cervical cancer within every 2 weeks. Each one is a tragedy and we can prevent it. Prevention includes primary prevention, secondary prevention and tertiary prevention. Primary prevention includes HPV vaccination.
Bismillahirrahmanirrahim. In the name of God, most gracious, most merciful, I thank you all for your efforts for this awareness. We, as we say in Farsi, آگاهی که درمانه. Awareness is the treatment. Okay? So if you're aware who is the enemy and where it is attacking you, you can find solutions for that. Okay? So one of the main issues that affects being susceptible to cancer and other infections is the decrease of blood circulation. Okay, this is an epidemic nowadays that most people have. They're not optimized. Their circulation is not optimized. Although we see them as normal population, but as you might say, Unani medicine or we say Persian medicine gives us clues to check the patients to see if their circulation is optimized or not. But this optimization is not visible in conventional medicine. So as we say Persian medicine, or you may say Unani medicine, gives us clues that shows lots of people, they have unoptimal circulation. So what we do is by tadabir, by non-pharmaceutical actions, we optimize the patients, the people's, the normal population's circulation. So the surveillance of the body is optimized, and it finds the cancer cells that are built up every day, and it kills them. So paying attention to optimal circulation of the periphery helps so much in cancer prevention. Thank you.
Now I would like to request Professor Irfan Asrin ma'am to speak a few words about this.
Good morning, all of you.
Good morning, ma'am.
I thank Professor Suhail Fatma for inviting us and all our faculty members also here for this awareness and sensitization campaign, specifically for these 3 forms of cancer. But it's nice to see that the awareness and the sensitization has not been limited only to a few schools. It is spreading around the campus, and we have made it a purpose to address all the schools, all the faculty, all the staff. So that is a very commendable work. In this line, I just like to add a couple of things. Our Honorable Vice Chancellor has also taken this Cancer Month very seriously, and we had a inter-hostel competition on the theme of cancer, which was coordinated by Professor Saidun Nisa. So we are trying our level best to make this a topic which is discussed at all levels and associated not only awareness but also sensitization, and also the association. Along with that, we also had a talk where the mental health issues addressed to the complications of cancer were also discussed, which was organized by Professor Dr. Sadaf Siraj and the mental health group. So the point here is that we want awareness at a holistic level, and it is nice to see that we have equal participation of boys and girls. So out of the 3 cancer, the 60% is related to the females, but the boys will form a very, very active part in discussions, in pushing parents, in pushing their sisters and their cousins for screening and all. So together holistically एक साथ मिल करके हम लोग बहुत इस पे काम कर सकते हैं और इसको eliminate कर सकते हैं. And today I was reading that breast cancer will become a very important deterrent in the growth of the Indian economy, because female population, if it is affected to such a level, तो economy जो है हमारे economic growth चरमरा जाएगी. So that would be the impact. So help each other by holding hands. Let's help the society and our nation at large. And prevention is better than cure, as you said. So this awareness will definitely help in prevention and awareness. And thank you all for making me a part of this important journey. So thank you once again. Thank you.
As all of you know, that this was the 4th activity in commemoration this World Cancer Day. First, we had these 8 guest lecture series on different aspects of the cancer. We covered and different expertise of their field visited our university, especially Dr. Majid Talikoti, who is in the Batra Hospital, oncologist. So that is today. Our medical students have learned a lot from them. And the second activity, we had this counseling sessions to different schools. So we have organized counseling session for our pharmacy college and science students and science staff. And now in planning, we are just in the dialogue with Professor Reshma Nasreen and different schools to organize such counseling sessions, including you all will be the participant there. And the third activity was we had hands-on training also, how to do this breast examination, how we will perform our tests.